Hello everyone, welcome to DK Talkies. Today we are honored to have with us a remarkable guest whose contributions to the field of chest wall deformity or pectus deformity and lung cancer treatment are nothing short of groundbreaking. Let me introduce you to Dr. L.M. Darlong, who's traveled all the way from Delhi to Mumbai for this podcast. Thank you so much, Doctor, for coming on our show today.
Thank you, Deepthi. It's a privilege for me to be here.
Thanks. So, Doctor, we have a next question for you. What inspired you to kind of pursue this career?
Well, first I became a doctor because my dad wanted me to do something in medicine. I'm the first generation doctor in my family. So that was the main inspiration. And once I got in there, then surgery was a natural choice because you wanted to do something more heroic.
Okay.
Having gone through Sainik school, from the army school, so you were always looking for some adventure or something exciting. So got into surgery, and then that's how we began my journey. So I was lucky enough to be trained in thoracic surgery. At those times, there was somewhere in 2000, early 2000,
Okay.
when thoracic surgery was basically not very developed in our country.
Okay.
Because it was mainly cardiac surgery in those times, and thoracic was something of a back burner, something
Okay.
more, not really ventured into.
Okay.
So I was lucky enough to get involved in this field, and I would like to thank my professors, Dr. Arvind Kumar and Dr. Professor Bal. Both are well-known doctors in Delhi, and I'm also practicing alongside with them in Delhi, and from there on, there was no stopping back. I think I got myself trained more, went outside the country in South Korea, and also in the United States. So I've been basically trained in both robotic surgeries also, and obviously the chest wall deformity, the nurse procedure, from which I have learned from South Korea, from the leader, that's Professor Park, who is a
Okay.
well-known figure in this.
Sure. All right. So, now we spoke so much about the pectus surgery, and you told us, what exactly happens to the chest wall. So, there comes our next question. What is NUS procedure for pectus deformities?
NUS procedure was originally started by Professor Donald Nuss.
Okay.
So in his innovation, it is named as NUS procedure after him.
Okay.
So it's basically about remodeling the chest.
Okay.
We put bars, basically these are medical grade stainless steel implants just behind deformity. We pushed it out basically.
Okay.
You are basically pushing the chest outside by using a bar placed behind it,
Okay.
so that the ribs, they are pushed outwards, and then they stay in place in that particular fashion. They are remodeled. The chest was remodeled to its new shape, the correct shape.
Okay.
So we leave the bar for 3 years because it's a time when it the body gets used to it, remodels, and the bones get remodeled, and it's taken off after 3 years.
Okay. So, then the next one is, what percentage of population in India is affected with pectus deformities?
If you look at such, we had no idea about pectus deformity long time back. It was mainly in the medical textbook. You ask any doctor, pectus deformity, he will say, pectus, that's the amount of curiosity we have. But we hardly see such cases because nobody came out. So what we have data are mainly from the western side. So if you see in the western figure, they say about 1 in 300 to 400 births. That's
Okay.
the frequency, the occurrence pattern.
Okay.
And it is more in males compared to females in the ratio of 3:1.
Okay.
But in India, definitely now, with the internet coming in, people becoming more and more self-aware
Sure.
about their health, about their body. Okay, so we are seeing more and more people scrolling the internet. I've got a website, it's called pectusindia.com,
Okay.
wherein I get a lot of queries regarding such cases from India as well as abroad,
Okay.
right from North America to South America, around Australia, New Zealand, and Middle East. So a lot of queries come from there.
Okay.
It's mainly the parents who are now seeing it at a young age, having a query about it. They just Google it, and then they are getting diagnosed in that way.
Okay, okay, all right. So you mentioned about the percentage. You said it could be somewhere where one female amongst two or three males.
3 males, yes.
So it's very rare, is what we can say. It's
Yeah,
quite
it's
rare.
not common
Okay.
because we don't have the figures.
Okay.
What we are seeing are basically people who are coming out and getting themselves diagnosed.
Okay.
There are many people who are just living it as we did because they feel it is not causing them any physical harm. It's mainly the psychological and emotional thing.
Yeah,
Yes.
got it. So there is no pain in the chest. There is nothing. It's a very normal life that people live, though they have a chest wall deformity.
Yes, most of the times when they're in normal, going to normal activities, there is no much problem. They might have some non-specific pain in their chest. They might feel some pain is there.
Okay.
Yes, they can have something like, you might notice some children, when they are playing, they get tired easily.
Okay.
That's because, because of the deformity, the capacity of their lungs and heart are decreased.
Okay.
So they don't have the maximum capacity in terms when they are going to stress, like in running activities where you have more physical stress is required. So you might notice in children that they get tired easily.
Got
The
it.
parents might see that they're getting tired easily compared to their peers.
Got it. Got it. All right. What are the early symptoms of pectus deformity, and what happens if there is no diagnosis done at an early stage?
As such, it is not going to cause any much physical problem. Like I've
Okay.
said, yeah, you might feel tired earlier compared to your peers when you're doing some
Okay.
activity, some sports.
Okay.
And the next is basically you might have some non-specific complaints like you have feeling that your heart is beating faster, palpitation we call
Okay.
it. That may be because it's pressing on your heart. And besides that, you are able to live a normal life. Only thing is that you might not be going out to parties or to swimming pool and taking off your shirt and swimming. So you are more of
Very
introvert.
conscious,
Yes,
yeah.
you're conscious.
Okay.
You're very conscious about your body, and you have. They do have psychological
Impact as
impact
well.
on that.
Okay.
Definitely.
Sure. Okay. How can we prevent this from happening?
There is no way you can prevent
No
this.
way.
It's basically just find out, and accordingly you can treat based on the age.
Okay.
It has got no relation to any deficiency of vitamin D or calcium.
Okay.
They are well nourished. It's a congenital thing.
Okay.
Only thing is, I would say is that if you see it, consult your doctor. Internet is there. You can see who the doctors are doing it, and plan the treatment. Because at a young age, if you see them, so by the age of 5 to 6 to 7 years, we can put a vacuum bell.
Okay.
It is basically a non-surgical thing because our bones are soft. At a young age, the bones are very, very soft. So we can basically suck it out with a vacuum bell.
Okay.
Once that fails, then surgery is the indication. That's a nurse procedure we do at the age of 13 years and above.
Okay.
So if you know it from beginning, you can do a conservative treatment. That's the vacuum bell.
Sure.
You can basically you are more aware about it, how you plan about it. Not you realize about it when you're past 20 years or 30 years.
Okay.
Because at that time the bones are more hard and the procedure is also more enduring for the patients because it's more painful.
Okay.
Yeah.
Okay. Got it. Sure. Which states in India have maximum patients with pectus deformity?
I cannot really say the states, but I would say, I have a good amount of people coming to me from North India and South India.
Okay, so northern
Yes.
part and the southern
Southern
part
part.
of India is where
Yes.
you get maximum population who
Yes.
kind of is has this kind of deformity.
Yes, yes.
Okay. Which countries have maximum patients of pectus deformity?
It is more in the Caucasians, in the Americans
Okay.
side. But if you see as such, the maximum surgery is being done by a single surgeon. I've talked to you about
Yeah.
my mentor, Professor
Yeah.
Park
Yes.
from South Korea. He has done the maximum cases. He may be doing about maybe 2-3 cases a day. That's the amount of cases they have.
Okay.
That may be related more to because they are more aware about their physical look. They're conscious about it, so they consult more.
Okay. Okay. All right. So, what is the tentative cost of this surgery in India?
See, the cost of surgery in my center is approximately about 4 to 4.5 lakhs.
Okay.
That cost is mainly because, see, we get the implants from abroad. It's based on dollars. As the implants, it's very important, the implants, because you cannot put any implants there. It has to be medical grade. You should not be breaking it when you're putting it for 2-3 years. They should not be breaking it. Plus, they should be MRI compatible.
Got it.
So with all those things, I mean, we are able to keep it a very, very low price of 4 to 4.5 lakhs with 2 bars. Because the same cost, if you go to US, it's about 60,000 US dollars at the cheapest.
Okay, all right. Which hospitals in India can offer this surgery?
I cannot really say, but we are the hub for pectus surgery in India.
Okay.
I've been doing this for almost more than 12, I think, 10, 13 years now. More than a decade, and so I mean, we are the center.
Okay.
It's a hub. It's not a procedure to be done on maybe one case in 1 year or 2 cases in a year.
Okay.
Because it's a routine procedure. This surgery is very, very much routine. It's not an emergency. In fact, I have a Pectus India support group.
Okay.
Anybody who comes to me, I don't advise them surgery immediately. I just see them. I ask them, see, this is the thing that we need to do based on your age. I would suggest that if you want to go for a correction, it will be a surgical procedure. You can talk to my other patients. It's very important we don't diverge their identity, because they're very, very conscious about themselves. I have never shown pictures of my patient on social media sites, but they have done it themselves. And I promoted that. Okay. But from my point of view, I always believe that patient's privacy is very, very much important because for such condition, they are very, very much aware about their condition. So we have got a Pectus India support group. They all go through that. They contact other people, other patients, their family, and then they decide about it, because they tell them how they went about this, how they got discharged, when did they fly back home. Because most of them are from outside Delhi. Okay. So they all want to know, as soon as the surgery is done, when can they fly back home? Do they have to stay back in Delhi for another 3-4 days? So all these questions get answered by, people from their own area or locality. Okay. So this support group is something I've started, which is basically run by my patients, for the patients, and I guide them.
Okay. Got it. So you kind of gave us information about the pectus surgery. That's nothing but the chest wall deformity. We also understand your specialization is to heal lung cancer patients, right? So what exactly is lung cancer?
See, lung is one of very important organ, just like a heart which pumps blood in the circulation. The lung is the one giving oxygen, which is definitely the main source of life. So a cancer which affects the lung is basically lung cancers.
Okay.
If you ask me about the cause of lung cancer, you all associate lung cancer with smoking. I think anybody you ask what is the cause of lung cancer, they'll just smoking. So this has been inbuilt in our mind that smoking causes lung cancer. If I don't smoke, I can never have lung cancer. Unfortunately, in the present era, it is no longer a smoker's disease.
Oh. We were not aware of this.
Yes. And in fact, it is now more of seeing it in more of non-smokers.
Okay.
And that too females.
Oh.
Younger age group. And research has shown us that the main cause is basically now non-smoking. It is basically because of the pollution we have in the air. Air pollution.
Got it.
And this is the biggest threat, I think, in the present era for lung cancers becoming more and more detected because of pollution in the air.
Okay. So it's not just with the active smokers, it's also with the passive smokers, and because of the air pollution that's around, the chances of lung cancer is also high.
Yes, you're absolutely right. That's why I said we always associated lung cancer with smokers. Now it is a non-smoker. It's air pollution again, I would say. It's PM 2.5.
Okay.
Particulate matter 2.5.
Okay.
That's a substance. It's a particulate matter.
Okay.
If you ask me the size of that PM 2.5, it is basically 1/30th of the diameter of our hair.
Oh.
It is so small that it goes into our respiratory tract from the nose. We breathe in the air, goes into the lungs, and from there goes into the bloodstream.
Got it.
Otherwise, most of the matter, particulate matters, are blocked by our nostrils, by the lungs, and they're in the airways. But this goes into the bloodstreams
Okay.
and can cause mutation in the body, especially in females,
Okay.
causing lung cancer.
Okay. What is mutation?
Mutation is basically something alteration in the genes. Okay, because the genes are something like which regulates our body cells. So they go and cause some change in the cells in the lung, which causes them to multiply irreparably. That's a tumor.
Okay.
So this PM2.5 causes lung cancers in that way because it gets absorbed in the blood system from the air and cause mutation, and that too specifically more in females. This has been recently validated by WHO,
Okay.
and this is the new what you call epidemic, I would say,
Okay.
because we are hearing a lot about air pollution everywhere, not just in India but all over the world.
Okay. So do you recommend we wear a mask just like we were wearing it during the time of lockdown?
I mean that is just a shortcut. That's
Okay.
not the main solution. I mean we should
Okay.
have some policy like we had policy on smoking. There are many places now you cannot smoke. It's a no smoking area.
Yes.
So I think some policy has to come in the way that now air pollution has to be controlled,
Yes.
because we should have the right to breathe clean air,
Absolutely.
clean water, clean air. This is very important.
Yes, and I think
Right.
we should stop chopping trees also, right? And we have to start growing more trees to protect
Yes.
our surrounding and our environment.
Yes, yeah, oxygen is definitely the
Yes. Yeah. Okay. So, what are the early symptoms of lung cancer, doctor?
early symptoms can be cough.
Okay, coughing.
Yeah,
Continuous coughing?
mainly coughing. Yes, can be continuous or intermittent coughing, dry cough, or maybe it's sputum. And presence of blood in the cough is a
Okay.
sinister sign.
Okay.
Otherwise, you can have non-specific pain in the chest, some amount of weakness, and sometimes you can have fever. So the main concern is basically, I mean, when you have blood in your cough, this is a very sinister sign.
Okay. And what percentage of India's population is affected with lung cancer?
If you see as such, I mean, we cannot talk about how much percentage as such, but it's approximately about 5.8% of newly diagnosed cancers are lung cancers.
Newly diagnosed
Yes, of all the cancers.
of all the cancers.
Yes.
So, what do you mean by newly diagnosed? So, you're saying that if
Of all the systems have.
Okay.
There could be oral cancers, breast cancers, colon cancer. From all these cancers, if you see as such, it contributes about 5.8%.
Okay. And is it that only in the last stage, one can identify that that person is affected with lung cancer, or do we have any kind of symptoms which are very early stage symptoms and one knows that there is something wrong and the person should now go for a checkup?
Cough is one early sign, basically. I mean,
Okay.
doesn't mean that all cough are cancer. Any cough which doesn't subside after you consult your physicians or a doctor, if it doesn't subside for more than 3 weeks after 3
Okay.
weeks of treatment, it's important that you get some amount of investigation done, which could be a chest X-ray and if not a low-dose CT chest. So these low-dose CT chests are basically, they've been recommended in the Western countries for screening lung cancers. The exposure to radiation is just about 25% of what you have in the normal CT scan. So they are able to pick up early changes in the lung, and then you can accordingly investigate them from the point of view of a lung cancer.
Okay. But is lung cancer also curable?
Lung cancer is definitely curable if you catch them in the early stage, stage
Okay.
1, stage 2. And for stage 4, I mean, most of the times you cannot have a cure.
Oh.
So it's important that you catch them early. But thankfully nowadays medicine has advanced a lot. We have got a lot of immunotherapy and target therapies. So we are able to basically control the disease, cure more cases. But ultimately it's basically about catching them early.
Okay.
If you catch them at stage 1, if the person is fit to undergo surgery, it's a one-step procedure. Surgery is the main treatment modality with the highest cure rate.
Okay. So lungs are now operated to kind of, remove the actual cancer from the lungs? Is this what you're saying, by doing a surgery?
Yes, we are now able to take out the affected lobes of the lung
Okay.
using surgery. And important thing is that now we are doing surgery which are less invasive, what we call keyhole surgeries, which can be using a thoracoscope or robotic surgeries. So, it is less painful, recovery is much faster, and we can send them home early. And whatever treatment needs to be done after the surgery are also being done on a proper time. So there is no delay in further treatment.
Okay.
It's become more and more safer.
Okay.
Yeah.
So how is surgery different to chemotherapy?
So when you do surgery, you are basically involving a surgeon who takes out the particular disease site. So it's more precise. You're basically going and taking out a particular disease site. So in chemotherapy, what happens is basically you're giving some injection in the body, which goes and kills the cancer cells.
Okay.
But at the same time, it also kills the normal cells also.
Oh,
It's like a carpet bomb.
okay.
So you are trying to kill something, and then in between there are a lot of collateral damages.
Okay. So there are some side effects also.
Yes,
that,
because it does affect the normal cells also.
Okay.
Besides killing the cancer cells maximum, but it does affect the normal cells also.
Okay.
So the body takes some time to recover again from it. So there are breaks.
Okay.
But fortunately, even chemotherapy are now more refined. The
Okay.
medicines are much better.
Better.
Yeah. So the side effects are also much less.
Okay. So what do you recommend first? Do you first recommend a chemotherapy, or is it the surgery for lung cancer?
For lung cancer, it depends on the stage.
Okay.
For early lung cancer, stage 1, surgery is the single modality for treatment.
Okay.
As the stage increases, stage 2, 3,
Okay.
in that case, we give chemotherapy also as part of the treatment, along with surgery, and sometimes we add immunotherapy also or target therapy also.
Okay.
So it's if you see lung cancer as treatment as such, it's a multi-modality. It's not just a single person in getting involved. We have got a medical oncologist, a radiation oncologist, our pathologist, our imaging people from radiology and nuclear medicine who help us guide.
Okay.
So we see the person, we decide the stage, we plan the treatment, and then accordingly we start the treatment.
Okay.
So we have to be prepared from beforehand, knowing what is the stage, what will be the treatment, surgery, chemotherapy, target therapy. Everything is planned that way.
Okay. So it is as per the stages of the lung cancer is what you recommend, whether it has to be a chemotherapy or something else or a surgery.
Yes.
Okay.
Early stages, surgery.
Okay.
The more advanced it is, it's a combination of surgery, chemotherapy, immunotherapy, target therapy, or radiation therapy.
Okay. Okay. Got it. Can you tell us how much percentage in men and women have you found out, or what percentage population comes to you amongst these two genders when it comes to lung cancer treatment?
I cannot really say the percentage, but definitely it is more in males,
Okay.
lung cancer. But unfortunately now we are seeing more of it in the female non-smoker, and that too with a different pathology we call adenocarcinoma.
Okay.
So
What
the
is that?
predominant one was before was squamous cell carcinoma, but now we're seeing more and more of adenocarcinoma, which is not smoking related.
Okay.
So I think this is a very worrisome trend. Adenocarcinoma, more in the females, non-smoking, and younger age group, whom we don't suspect.
Okay.
As a result of which, we are seeing them, a lot of them in the stage 4.
Okay. Okay. All right. Which are the countries which are affected more by lung cancer?
If you see as such, the maximum data we have for lung cancer, we see from the Western countries.
Okay. And why so?
It has been mainly because of the smoking.
Okay.
Yeah, but if you see as such, smoking has reduced in the Western countries, but still, they are definitely having more cancers, and I think pollution must be one factor. Because some studies have come from countries like Taiwan, wherein they did screening of lung cancer for non-smokers basically, and they found that there was a huge high chance of having lung cancer in female non-smoker.
Okay.
Yeah, so they have done this screening, among the females, non-smoker female, and they found that screening was definitely much helpful in detecting them at a very early stage.
Okay. Okay. All right. Do you kind of, you have any definition of healthy living or healthy lifestyle?
I think healthy living, healthy lifestyle, I think we should all try and look for it. It's nothing like what is given the book. I think
Okay.
we have to see based on our work. Even I have tried and made a difference in my lifestyle,
Okay.
like going to work in the morning and evening, and food. Avoid junk food and all that. And so, I always try and maintain my lifestyle now. It's been about more than a year now that I've really changed my lifestyle to fit into my work schedule,
Okay.
which is quite stressful. So, a bit of exercise in the morning. Just walking around. I think that's the first step. You cannot have a perfect day, but walking in the morning and evening, I think is definitely
Essential,
very
yeah.
essential.
Okay. And what about the food lifestyle, as in food patterns?
Food pattern, I think you should avoid junk foods.
Okay.
I recently read a book called Glucose Goddess by Jessica Inchops.
Okay.
I would suggest everybody to read it. It's a very simple book. It's just a hack on how to consciously eat your food in what sequences. Because the sequencing of our food, I think, has a lot of impact on how our body digests things and how it controls the sugar spike in our system.
Okay. Okay. All right. So you gave us one book which you've read. Say the name of that book again.
Glucose Goddess, the hack basically. It's
Okay.
about Glucose Goddess.
Okay.
It's by Jessica Inchops.
Okay.
She's a biochemist, and she's written a beautiful book on just showing how the sugar spike affect our craving for food and having healthy lifestyle.
Okay. So how many lives have you saved so far?
I believe that whenever I see a lung cancer case, as part of our multidisciplinary team with our oncology colleagues from medicine and radiation, every single person we do surgery on, I think we are saving their lives and contributing a small part of it in this huge burden of lung cancer in India.
Okay. So with overall, how many years of experience do you have when it comes to lung cancer?
I've been involved with lung cancer right from maybe 2000.
So around 2000
Yes,
onwards.
and I've been focused specifically on lung cancer for the last 10 years.
Okay. And what about chest wall deformity?
Yeah, chest wall deformity has been more than a decade now.
Okay, okay, all right. So many lives you must have saved so far, isn't it?
I think it's a small contribution along with all my other team members.
Yeah.
Because lung cancer, it's the number one killer. And every life matters in that. And those who can undergo surgery are the ones which are detected early, and those are the ones which are curable.
All right. So, truly it was a very inspiring and enlightening conversation that we had today with you. There are few other credentials that you've already shared with us, and we've kind of, gone through it as well. And we see that there is some kind of robotic neo-rib method that you've used, which is also called as the ND-YAG laser lung surgery. And I think you're a part of that center as well. So what is this?
Yeah, it's two things. Basically, one is the NeoRip technique,
Okay.
and other one is ND-YAG laser surgery for lung.
Okay.
So the NeoRip technique as such, if you see, you have tumors in the chest wall. That's basically the bones.
Okay.
So for a tumor surgery, it's important that you take out the whole tumor.
Okay.
And chest being a very vital organ, because we breathe because of the rib cages. So this is my technique, wherein we have used a simple wire, or the sternal wire we call it, which is easily available in the operation theaters. All the thoracic surgeons have it. And most importantly, it is cheap, it is compatible with MRI.
Okay.
Because if you have something implanted in the body which is not compatible with MRI, the person can never undergo any MRI in the future for any test. So this is a NeoRip technique we devised in our center. wherein we avoided the costly implants in cancer cases, wherein we reconstruct the rib using this technique, which is cheap, easily available, and very, very cost effective. So it's been received very well by our medical colleagues, and many centers are using my technique of neorib,
Okay.
we call it. And coming to the laser surgery,
Yeah.
we do this basically for metastasis, what we call cancer cells which are spread to the lungs.
Okay.
As we know, the lung is in our body is the site which receives maximum blood.
Okay.
It gets directly from the heart. So tumor cells spread through the bloodstream also. So when they are pumped into the lungs, some amount of tumors get deposited in the lungs,
Okay.
which the system in our body cannot control them. So they grow there.
Okay.
So it's so we have a treatment called metastasectomy. It's basically taking out the tumor cells which are localized to the lung. So previously we were able to take out just a few of it because taking out required removing part of the lung
Oh.
with a conventional staple technique. So with this technique of laser, that is the Nd:YAG laser, we are able to take out multiple deposits in the lung.
Okay.
So this is called Nd:YAG laser. So our center is the only one in India. We have the Nd:YAG laser system, and we are running the laser metastatic program successfully for almost 2 years now.
Okay.
Yeah.
So how is thoracic surgery different to this?
So this is all part of thoracic surgery.
Okay.
So in thoracic surgery, you have something called cancer disease and non-cancer disease.
Okay.
So I'm basically dealing with the cancer part.
Okay.
Because there are a lot of other non-cancer diseases like because of tuberculosis, because of infection in lung, fluid, and obviously trauma, chest traumas.
Okay. Okay.
So these are all part of general thoracic surgery. But I'm specifically dealing with the oncology one. That's a cancer part here. So thoracic, if you see as such, is a big field.
Okay.
It includes both the oncology, the cancer and non-cancerous part.
Okay.
So my focus has been basically on the cancer part.
Got it. Sure. So हमने सुना है आपका खुद का क्लिनिक भी है दिल्ली में. So what kind of treatments do you offer in your clinic?
So in terms of lung cancer, we have a dedicated team of specialists. I am leading the thoracic surgical part. I have my colleagues who run the medical part, medical oncologists, the radiation colleague who runs the radiation part of it. So lung cancer treatment is multidisciplinary. Whoever comes to us, we have got a set protocol. That these are the tests we need. This is how we investigate you. Based on your stage, then we decide basically now how you go about it. Whether you go for surgery first, or whether we send you to a medical oncologist who give you some medicine to basically bring down the disease down, and then we operate you. So it's a teamwork basically, and we know it beforehand. We plan the treatment, how it is going to take place, the sequencing, because that's very important to have the optimal outcome.
Okay.
Because for a disease like lung cancer, which is basically very, very challenging, it's important that the team decides how we go about it. As a person, I can be biased. So when my team sees together, we give the best outcome to our patients, because the treatment doesn't stop once we do the surgery. It just began. We need to keep them on follow-up for a very long period of time.
Okay. So we would also like to talk a little more about the credentials that you've already, received. So we know that Dr. Darlong's journey is an inspiring, just like your achievements, Doctor. And we also know that you began your education at Sainik School, Impal, known for instilling discipline and nurturing leaders. And we know that, Doctor, you've also earned your medical degree from Gandhi Medical College, Bhopal, followed by an MS and residency in thoracic surgery at All India Institute of Medical Sciences, Delhi. And you further specialize with a fellowship at Korea University Medical Center and advanced training in Da Vinci robotic surgery in the USA, right? And Dr. Darlong is also one of the reviewers for most of the publications for both national and international publications. And we also understand that on top of his clinical excellence, he is also a dedicated medical scholar with numerous publications which are in esteemed journals, and you have been reviewing that at an international and at national level. And we've got the motto that you have. He believes in the motto of saving lives for lung cancer surgery and also changing lives with Pectus Deformities surgery. So that's what he's told us, and that's what we can see, with all the incredible work that he's done. He's saved so many lives, and he's also given, he's also made so many changes in people's life when it comes to chest deformity. And if you want to contact Dr. L.M. Darlong, we've given his bio link already in this video. Feel free to connect with him, and let's save maximum lives with the kind of knowledge and the help that he is offering. So, Dr. Darlong, thank you so much for coming over on DK Talkies today. It was really nice talking to you. We wish you all the best, and we wish, that so many lives that you're changing and the kind of transformation that you're giving to them. We hope you continue with this good work forever.
Thank you very much.
You're welcome. So, what an inspiring and enlightening conversation we've had today with Dr. L.M. Darlong. From pioneering groundbreaking techniques like the neo-rib method and the modified NUS procedure to leading advancements in robotic and VATS lung cancer surgeries and leading India's first ND-YAC laser lung cancer center, Dr. Darlong's work is truly transforming in the field of thoracic surgery. His dedication to innovation, patient care, and medical research is a testament to his passion and commitment to saving lives and improving surgical outcomes. Dr. Darlong, thank you so much for sharing all the insightful and incredible journey and all the expertise that you have. And it's been an absolute honor, obviously, to have you here today on DK Talkies. To our viewers and to our listeners, thank you so much for tuning in. And if you feel this particular episode has helped you, do share, subscribe, and view our channel daily. Remember, it's DK Talkies, and follow Dr. Darlong also to understand the kind of work he does. See you soon then. Bye.